Hello. We're going to be treating a peg lateral with specialized matrices by Bioclear. We're going to be using the BT matrix, which is great for both diastema closures, such as a peg lateral, and black triangles. We're going to be featuring a technique called the Direct Contact Strut. Now, we're going to be building a contact here on the distal, here on the mesial, using two different varieties of the Direct Contact Strut. Let's go ahead and try in our matrices. I'm going to be using matrices from the BT kit. We'll open up the kit now. I'll be using a matrix from the small kit. I've selected yellow for the mesial. That corresponds to a certain emergence profile. And now I'm going to get into the large tub of matrices. And in that tub, I'll be using the matrix with the green emergence profile. The green has a little bit more emergence profile than the yellow. So now I'm going to go ahead and try in the matrix for the mesial. In this particular case, the dentiform does not have realistic soft tissue. On a young patient, you would definitely have a papilla here. So we're really matching the anatomy of the tooth on the other side. So obviously, we would not leave a black triangle on an adult, but because the dentiform is unrealistic, we're going to go ahead and use the yellow on the mesial and the green on the distal so that we can match the anatomy of the contralateral tooth. I'll be looking at the matrix on the distal now. That's going to give us a nice shape once we're able to create the direct contact strut. So let's go ahead and go through the process. The first thing that we would do is to disclose and blast the tooth to remove biofilm and the protein pellicle. So let's go ahead and do that now. So here I'm using the Bioclear dual color disclosing solution. Now, of course, we're not going to have much biofilm on a dentiform tooth like this, but we still want to go through the process to demonstrate the steps. Okay, let's go ahead and do the direct contact strut on the mesial. So I'm placing the small yellow BT matrix, and then what we'll do first is to acid etch a small area. I'm going to use the Scotch Bond Universal Etchant. Go ahead and push the BT matrix apically so that you get a good visual image and a memory of what the matrix looks like when it's fully seated. While I'm holding the matrix in place, I'll come in with the phosphoric acid, and we're going to etch this area generously. We're going to etch about twice as much as the actual area of the adhesive. We want to make sure that the area is very well etched. Now I'll go ahead and rinse that away after etching for 15 seconds on enamel. Step number 2, we're going to take some lubricant. I'm going to be using Vaseline, and we've got a little bit of Vaseline on this little bender brush. Let's take a very small amount. I'll continue to hold the matrix in place and gently wipe just a bit of lubricant on the neighboring tooth where the contact is going to be built. While we're still holding the matrix in place, I'll go ahead and air thin that Vaseline. Now I'm going to come in with the adhesive. I'm going to continue to hold the matrix in place to create a barrier. I'm going to put just a bit of Scotch Bond Universal Plus on the enamel. There's no need to massage it, just get it wet. Remember, use a very small amount of adhesive. And then we'll go ahead and air thin. We're going to continue to use the matrix as a simple barrier. Next, without the need of pre-curing the adhesive, we're going to bring in the syringe of cold flowable, and we're going to bend this syringe with the hemostat parallel to the long axis of the cannula. We're going to squeeze it so that it has a narrow tip just like this. This will allow us to have a nice thin tip to go deep into the embrasure. So that's about the right shape for the cannula. We're going to go into the contact area. I want to come in and have this be in the heart of the future contact, both buccolingually and occlusogingivally. And it's going to be about the width of this bent cannula, about 1 to 2 millimeters. So we come in, we put this dot of cold flowable composite at the contact area. That's going to be right in the middle of the contact, just like this. So we'll come in like so. We'll put a dot of cold flowable composite at the contact area. That's going to be in the heart of the future contact. We don't want this to be too far to the facial or to the palatal, like I was saying. You want it right in the heart of the contact, both buccolingually and occlusogingivally. Let's go ahead now and cure. Ideally, we would like the base of the contact to be a little bit smaller on the Vaseline tooth than it is on the tooth with the adhesive that we're going to be permanently bonded to. Right now, it's about the same size. So what you can do, if that area on the Vaseline tooth is very large, you can make the footprint slightly smaller, is to come in with the barred Parker and make the base of this direct contact strut slightly smaller on the neighboring tooth. You can also do this technique to make the footprint on the Vaseline tooth a little bit smaller with the blue contact saw that's in your kit when you come in from the occlusal. Okay, let's go ahead and use the Clark Explorer. We want to use the straight end of the Clark Explorer. We're going to pry the teeth apart and make sure that we see clearance between the direct contact strut and the neighboring tooth that had the Vaseline placed. You can definitely see that I'm creating clearance. We can definitely see that we have a lack of adhesion on the Vaseline tooth and good adhesion on the peg lateral. Let's go ahead and get our matrix, and we can reuse this matrix and rinse off the Vaseline, or we can get a fresh matrix if you're worried about contamination. So now I'm bringing in the yellow BT matrix. Make sure that the color goes away from the tooth toward the incisal edge. You're going to want to bring the matrix in at about 45 degrees into the embrasure, just like so. That's because the embrasure has a certain angle and the matrix has a lot of curvature. Now I'll take my right hand and I'll pry open the contact just like we practiced a minute ago, and then we'll drop the matrix through the contact with my left hand. Now you should have good tension as you slide the matrix apically. It feels just a little bit like a black triangle now. Notice I'm pushing apically on the matrix and it's not bouncing back occlusally. So we know that that's a perfect direct contact strut. In the heart of the contact, occlusogingivally, buccolingually, it's exactly what I want to see. So now that we're happy with the direct contact strut on the mesial, let's go ahead and proceed to the distal contact. On the distal contact, because we have such a large space between the teeth, there's no need to use a barrier matrix. So we're going to go ahead and do the etch and adhesive here, and then the lubricant over here. On the distal, because there's such a large space, there's going to be no need to use a barrier matrix when we put the etch and adhesive on the peg lateral tooth and the lubricant on the lubricant tooth. Also, because it is a large space, we will probably have to create the direct contact strut in 2 steps and essentially build a bridge between the teeth for this very large diastema. So we'll be following about the same sequence that we did on the mesial. We'll come in and acid etch an area about twice as big as the area that we'll need for the actual adhesive and the direct contact strut. In this case, we're going to be hitting at the heart of the contact on the canine, which will be slightly further gingival than it was for the central incisor because of the anatomy of the canine. So we'll be in this zone here for the canine. Once again, a little bit lower on the tooth because that's going to be the heart of the future contact on the canine. So after etching for 15 seconds, we'll go ahead and rinse and dry. We'll come in here on the canine with our lubricant, put just a small amount on the mesial of the canine, and we'll air thin that. Now we'll come in with the Scotch-Bond Universal Plus and apply adhesive to our contact area on the peg lateral, which will be approximately here. We want to use a very small amount of the adhesive. Next, we're going to air thin, and then we'll bring in our cold flowable composite. At this point, I'm going to use the unflattened cannula for the composite. So I'm going to bring the flowable in here, and then I'll put some flowable on the contact area here, and then let's cure. Now let's finish our bridge, making sure that the base on the peg lateral side is reasonably wide. We want to make sure that the direct contact strut is smooth and that we have a good purchase or large area on the adhesive tooth. We want to make sure that we have a smooth strut and also that we have a good purchase on the adhesive tooth or the peg lateral tooth. So we'll make the base of the peg lateral a little bit wider than the base on the Vaseline tooth or the canine. So I'm a little wider on the base of the peg lateral or the adhesive tooth than I am on the Vaseline tooth. Let's go ahead and light cure. Perfect. Now let's go ahead and test. Make sure that we can break open the contact here, and you should be able to see that we have a little bit of clearance, but this is going to create a very tight contact. Let's increase our magnification and take a good look. So that's good clearance. Once again, we can take our barred Parker and remove any excess areas on the little finger that rests against the Vaseline tooth or the canine tooth. That will help us to slide the matrix into position. We can also use the blue contact saw that's in the BT kit to come in and open it up just the tiniest bit on the Vaseline tooth. However, we want to be very careful because this is a very delicate direct contact strut right now. At this point, if you'd like to, you can rinse away any of the lubricant on the canine because we're no longer needing it. This can eliminate any potential contamination. Now we're ready to go ahead and bring in our large green BT matrix on the distal. So, just like on the mesial, we're going to bring the matrix in at about 45 degrees to the embrasure. We'll use the straight end of the Clark Explorer to pry the teeth apart, and the matrix should go in nicely. Let's try that one more time. Remember, you bring it in at about 45 degrees. Now, they tell me that repetition is the mother of learning. So when I did this the first time, I struggled just a little bit. But now that I've done it 10 or 15 times, it's really become very easy. There are a couple of things we're going to take a look at right now. Let's take a look at our direct contact strut position. It is centered in the middle of the contact area. It's in the right position both buccolingually, and I like the position occlusogingivally. We're going to check the arrangement of the flaps. This is a good arrangement of the flaps. If I have the yellow on the outside, sometimes that can be less optimal. So let's reverse the flaps just to see the difference. And you can see this is not as optimal as the arrangement that I had a minute ago. So we always check the lingual flaps. Typically, it's an outside to outside relationship or inside to inside, where one matrix is either inside or outside of the other one, both on the facial and lingual. Realistically, the best thing you can do is to look at the arrangement and ask yourself, is it creating a good box? So once again, when I had the yellow on the outside, it was less helpful. So always check the arrangement of the flaps on the lingual with Bioclear. There's usually one setup that's better than the other. So a couple of things we're going to do before we injection mold. I like to have the matrices with the same height, so I can tap on them and keep them in place, and it's also a visual landmark so that I know if the matrices have moved. So I'm going to go ahead and trim the distal matrices so it's approximately the same height as the mesial matrices. So here I'm checking the matrices. I can gently tap on them. Let's go ahead and acid etch. So we acid etch everything for 15 seconds. Make sure to reach under the contact areas to get complete etching. Always check carefully to make sure that all of the phosphoric acid is gone after rinsing. Use your mirror on the lingual and do a very careful visual check. Let's check both the facial and the lingual to make sure all the blue etchant is gone. Now let's go ahead and bring in a large application of Scotch-Brite Universal Plus. We're going to come in with the adhesive and we'll bathe the area with a generous amount of adhesive. You can also use the large applicator for this. Then always make sure that the matrices are seated. We want to use a generous amount of adhesive everywhere. This is something that you just have to get used to. So using a small applicator does a good job of getting the adhesive here in this very small area under the contact area. Okay, let's go ahead and air thin, but do not light cure. Next, we come in with the heated flowable composite. Let's go ahead and bend the tip of the heated flowable. I'll show you this one more time. The bent cannula is much easier to get into small areas. So here we go. I'm going to come in and do the most challenging area first, where this embrasure is very narrow. Check the lingual. Make sure we're able to get the flowable all the way around to the corner, but we want to make sure and engage the flowable and inject into the flowable that went around the corner from the facial, and then that moves any air bubbles out through the connection between the two matrices. Once again, we have not light cured yet, and now I'm going to come in with the heated paste composite. I'm going to reach under the matrix, make sure that you're injecting under the matrix. Then I'm going to inject to the left and the right like a window washer. Make sure you're injecting under the matrix. Now I'll come in with a second compule. You'll notice that I'm holding the incisal edges of the matrices while I'm injecting the paste. At this point, I'm going to begin to pivot from a facial direction to more of an incisal direction. You want to slowly change your angle from the facial and slowly pivot it toward the incisal. Now, if it's a very large tooth, you can actually pump in a third compule of paste composite. Your job when you're injecting the paste composite is to displace most of the flowable composite, just like using light body and heavy body. Now, let's come in with a paddle and we'll quickly massage here on the facial and remove some of the excess. And also we need to massage the matrices because they've been expanded a little bit too much. So we massage and massage gently on the matrices to get them back to their more natural position. Okay, let's remove excess here with the dry brush. Now we're ready to light cure. We'll cure 10 seconds, 10 seconds, 10 seconds, 10 seconds, 10 seconds, and 10 seconds to make sure that we're fully cured.